Welcome back to Part 2 of the A, B, C's, and D's of Medicare. Here in Part 2, we'll learn about Medicare Part D, Medigap, also known as Medicare Supplements, and be introduced to Medicare Part C, Medicare Advantage plans. Part D, prescription drug coverage, are optional prescription drug plans, PDPs, governed by the federal government but administered only by private carriers, not the federal government. PDPs can be paired with other Medicare products. They add prescription drug coverage to Original Medicare Parts A and or B, Original Medicare Parts A and B with a Medicare supplement, and some Medicare Advantage plans, including some Medicare private fee-for-service and medical savings account plans. Everyone who is eligible for either Medicare Part A and or B is also eligible for Medicare Part D. In the example shown, you can see how to tell if someone is eligible for Part D by looking at their original Medicare card. In the first example, John Smith has Part A only. You can tell this because he has a date for Part A, but not Part B. In the second example, John Smith has Part B only. You can tell this because this time he has no date for Part A, but does have a date for Part B. In both examples, John Smith is eligible for Part D because he has Part A or B. And of course, if someone has both Parts A and B, they are also eligible for Part D as well. There are two ways to get prescription drug coverage. One way is to enroll into a standalone Medicare Part D plan. This coverage will be in addition to Original Medicare, Parts A and B, and or any Medicare supplement plan. The other way is to enroll into a Medicare Advantage Part C plan that includes prescription drug coverage. This coverage will combine medical and prescription drug coverage together into one Medicare plan. Beneficiaries are not required to have or elect coverage at the time they become eligible, but those that don't will likely pay an ongoing monthly penalty when they enroll later. Beneficiaries pay monthly premiums that vary by plan and carrier. This is in addition to the Original Medicare Parts A and B premiums that they must continue to pay. The cost for standalone PDP can vary widely and change from year to year. Premium prices range and depend on the plan. Deductibles also vary and could apply differently to higher tier medication. Several factors determine how beneficiaries will pay for each prescription throughout the year. An individual's copay or coinsurance will vary and is based on several factors, such as the plan, whether it has a deductible and if it has already been met, whether the pharmacy is in or out of network, whether the drug is on the plan's formulary or list of covered drugs, and what tier the medication is on. Generally, the lower the tier, the lower the cost. The length of the prescription, and the coverage benefit phase reached by the member, which is based on how much has been spent on their prescription drugs year to date. When we take a deeper look at the coverage phases, we see that Medicare prescription drug plans have a phase called the coverage gap or donut hole. When a beneficiary reaches this phase, their cost share may change based upon the type of drugs they are taking. Here's a look at how the donut hole works. The new plan year starts on January 1st, or the first day of plan coverage for initial enrollments. This is the deductible phase. A beneficiary must pay on their own for prescriptions until they have met their PDP's deductible. After they have met that deductible, they move into the initial coverage phase. During this phase, the beneficiary will pay only their required copayment. Once the total amount spent by a beneficiary and the plan reaches a predetermined amount, they enter the donut hole or coverage gap. Most Medicare drug plans have a coverage gap. The coverage gap begins after the total amount spent by the beneficiary and the plan reaches a certain amount for covered drugs. While in the donut hole, beneficiaries will pay a higher amount for their prescription drugs. The percentage of the plan's cost for both brand name and generic drugs that beneficiaries pay while in the coverage gap may change yearly. Then, once a beneficiary spends the required yearly amount to get on the other side of the donut hole, the plan will once again contribute a greater portion of the beneficiary's prescription drug costs. This is called catastrophic coverage and will continue until December 31st. How can you get out of the gap? These costs, sometimes called true out-of-pocket or true costs, all count towards getting out of the coverage gap. The beneficiary's yearly deductible, coinsurance and copayments, the discount on covered brand name drugs in the coverage gap, and what beneficiaries pay in the coverage gap. The drug plan premium and what beneficiaries pay for drugs that aren't covered do not count towards getting out of the coverage gap. Some plans offer additional cost-sharing reductions in the gap beyond the standard benefits and discounts on brand name and generic drugs, but they may charge a higher monthly premium. beneficiaries should check with the plan first to see if their drugs would have additional cost-sharing reductions during the gap. Beneficiaries who have a Part D prescription drug plan need to carry their Medicare prescription drug plan card along with any other cards they need, such as their original Medicare card. Every time a beneficiary picks up a prescription, they will use their card, so they only need to pay their part of the prescription cost. Unfortunately, because there is no magic crystal ball to see into the future, there is no way to predict exactly what someone on original Medicare will pay in total each year for all their prescription drugs and medical expenses. Every time a beneficiary uses a service or picks up a prescription, they must pay their share. Original Medicare pays for most, but not all, of medical bills, leaving beneficiaries responsible to pay the remaining portion, typically 20%, of the Medicare-approved amount of the service. These costs include co-payments, co-insurance, and deductibles. Various out-of-pocket cost estimators and tools to help Medicare beneficiaries try to estimate their known costs, but they can't account for new medical issues or unexpected surgery. Because it's difficult to predict how much out-of-pocket costs will be, some beneficiaries supplement their Medicare coverage with a Medicare supplement plan, also known as a Medigap plan. Medigap, or Medicare supplement insurance, enhances original Medicare by paying for certain co-payments and co-insurances for the member that original Medicare would not pay. Medicare supplement plans are optional financial products sold by private companies. Every Medigap policy must follow federal and state laws designed to protect members, and they must be clearly identified as Medicare supplement insurance. Insurance companies can sell only Medigap policies with standardized benefits among all carriers. Carriers do not have to offer all plan types. Medigap plans are identified in most states by letters. There are 10 plans available in most states, and each one offers its own combination of the same standardized benefits, and some offer additional supplement benefits. The chart shown here compares the different Medigap plans available in most states. It is important to remember that Medicare supplement insurance enhances original Medicare by paying for only certain medical expenses in the gap. Medigap policies do not cover prescription drug coverage, long-term care, like care in a nursing home, vision or dental care, hearing aids, eyeglasses, or private duty nursing. Everyone who is eligible for original Medicare is eligible to purchase a Medicare supplement plan. For the 6-month period that starts automatically once a beneficiary is 65 or older and has Medicare Part A and B, they are in what's called the guaranteed issue period. During this time, they have the right to enroll in any Medicare supplement plan offered by any insurance company in their state, regardless of their health status. After the end of the individual's guaranteed issue period, insurance companies use a process called medical underwriting to determine an individual's health status and use that information to decide whether to offer coverage and at what price. The best time for a beneficiary to buy a Medigap policy is during their guaranteed issue period. If they are able to buy one after this enrollment period, it may have a higher premium. What are the Medigap premiums? Medicare supplement plan monthly premiums can be costly and vary by carrier and plan type, gender, age, smoking status, and primary residence. These rates are typically more expensive than MAPDs and will also go up as a beneficiary ages. Depending upon the type of plan the member selects, they may also face additional costs for certain services. Beneficiary with a Medicare supplement will have to carry and use 3 different cards: their red, white, and blue original Medicare card, their Medicare supplement plan card, and possibly their PDP prescription drug plan card. So that's it, right? Well, no. If you're thinking the sort of one-size-fits-all approach to medical insurance through original Medicare might not be a good fit for everyone, you're right. Not everyone prefers to get their medical care in the same way, is concerned about staying within a network, has the same concern about costs, and has the same tolerance for risk. Part C, Medicare Advantage, is an all-in-one alternative to original Medicare. Medicare Advantage plans are medical plans created by private carriers and administered by the Centers for Medicare and Medicaid Services, or CMS. Plans always contain Parts A and B, medical and hospital benefits. It can also bundle with them Part D, prescription drug coverage. To learn about Medicare Part C, Medicare Advantage plans, take a break and then go to Part 3 of the A, B, Cs, and Ds of Medicare.